There are some questions that have been asked since the last video went out, and I'm happy to say I have some answers for you. Number 1, how am I feeling today? I'm happy to tell you that the first day I did not feel any pain. After that, the second day, my left arm was a little sore, but the day following that, the pain was almost gone. Today, I can easily move my arm. I do not have any pain at all. And I also wanted to give you a frank presentation and tell you how I felt, so I did not take any Tylenol or ibuprofen. In the clinical trials, the commonest side effect that people had was soreness of their arm. That's about 80% of people. And the next side effect was fatigue. That was experienced in 60% of people. And 55% of people had headache. Some people had muscle pain. That's about 38%. And about 14% had fever. Joint pain was experienced in about 23% of people. Severe adverse events were not reported in the clinical trials. However, you should know that clinical trials are done under controlled environments and are not really reflective of what happens in the general population. Some people may experience some symptoms which currently have not been documented, which we'll probably know of as the days go by. There are some symptoms that you need to go to the emergency room directly if you ever experience. And some of these symptoms are 1, difficulty breathing. The next symptom will be throat and facial swelling. You should also go to the emergency room if you have diffuse body rash and also a fast heart rate together with dizziness and weakness. I do not know if these symptoms are long-lasting, but with most vaccinations, a lot of these symptoms kind of go away within a short period of time. And also you should know that in the clinical trials, majority of people had more symptoms after the second dose, and symptoms are noted to be more rampant in people who are less than 55 years of age. And for those who are older than 55 years of age, usually do not have as many symptoms. How many shots are involved in the vaccination series? Number 1, for the Pfizer vaccine, you need to get 2 shots, which are 21 days apart. That's 3 weeks apart. For the Moderna vaccination, it's also 2 shots, and it's also 28 days apart or 4 weeks apart. It's important to get your second shot because your second shot is what produces what we call neutralizing antibodies that helps for you to build immunity against this virus. Does the vaccination prevent you from getting COVID-19? I'll tell you one thing, and from the clinical trials, it does not. However, it prevents you from getting severe disease that may put you in the hospital. At this time, as we continue to learn more about the vaccine and as more people get vaccinated, you are encouraged to continue to wear your mask covering your nose and mouth, and also to social distance. Thank you. Help us to move forward by getting your vaccine.